It was initially my wife that actually suggested that we needed to get out of the States, she saw the changes that were happening for me and how I was really doing poorly. And she brought it up and recommended that we look at moving out of the States. And we looked around in Europe, we looked all over the place, and it was actually a recruiting email that brought me to New Zealand.
I was working at one of the largest hospitals in Seattle, Washington, as a respiratory and critical care doctor, as well as doing general internal medicine, and it was pretty full on. I reached out to a friend who was working at Palmerston North Hospital that I trained with, and she suggested that we have a look at it, and particularly the small towns. So that's the main reason why we came to Timaru.
The medical system in the States is horribly broken and frankly traumatic to practice in as a doctor. And then horrible on me and my family, not getting any time with them, not getting to be able to recover.
So it's been a big improvement in my practice, so I don't worry so much about being able to get my patients the inhalers that they need or the tests that they need. There's pluses and minuses to each of the systems, but I think this system works better for how I like to practice.
Like I said, it's so much easier to practice medicine over here, to be able to have all of the supports in the hospital around the patient and outside the hospital for when I need to discharge a patient who needs ongoing care. We're certainly needing to work aggressively on hiring. We are eager to have any more overseas doctors coming in. I know New Zealand's always glad to have more medical expertise coming in and help filling our ranks of doctors.
So we've failed to train the numbers of doctors that we've needed for some time. This is a problem that's actually gone back decades. We have only 2 medical schools. We're about to increase to a third. And we really need to be growing our own doctors locally, but we also need to be keeping them here. And we do a great job of attracting and recruiting people to New Zealand, but we don't keep them here. So the terms and conditions that our people are working in, and that's not just doctors, that's all health professionals, nurses, allied health people, dentists, podiatrists, etc. We don't do a great job at creating the terms and conditions that make them want to stay.
There is a big pay cut. For me, coming from California, the cost of living is actually quite a bit cheaper over here, so my money goes a lot further. Having a lot of those support services for my family, having excellent childcare for a very reasonable cost is life-changing for us. That really allows us to do a lot more.
Do you think you'll stay? Have you made that call?
Yeah, we've been here just coming up on 5 years, and this is where we live now. We like it.
I'm staying. We love it here. We're here permanently. We're not going anywhere.